Welcome back to ophthalmology for undergraduates and postgraduate beginners. Today we are going to see a important case which, if it comes on the day of the examination, will definitely be kept as a short case. So students should be prepared to take this case and answer the questions. In this patient, you can appreciate the left eye, there is closure of the eyelids. Patient is not opening the left eye. There is drooping of the eyelids, that is called as ptosis. Apart from that, if you keenly observe this patient, the left eye which is closed is appearing flat. It is appearing flat and it does not have any convexity. What may be the reasons for this? Whenever we are going to see a case where there is complete ptosis with flattening of the eyelids, it can be due to two reasons. The first reason is there will be a normal eye behind the eyelids, but it has got displaced. It might have gone backwards because of the fracture of the orbits, so that the lids become flattened. That is called as inophthalmos, that is backward displacement of the eyeball. Or the eyeball can have displaced or may have displaced into the sinuses. If there is a fracture of the floor of the orbit, the eyeball might have subluxated into the maxillary sinus. So, these may be the reasons for a flat eyelids when there is a normal eyeball. The second important cause is shrunken eye or shrunken eyeball. The eyeball has become very small. It is not a normal eye. The small eye can be due to two reasons. One is phthisis bulbi. Another reason is atrophic bulbi. What is this phthisis bulbi and atrophic bulbi? In our patient's left eye, when the lids are open, you can very well see that black things inside the open lids. You are not able to find out a normal eyeball. It appears a disorganized eyeball, some remnants of cornea are seen, which appears black. It is not circular. The eyeball is distorted, totally distorted. So that is called as phthisis bulbi. Shrunken, disorganized eyeball. So I have drawn this picture here. You can see it is a crumpled ball. It is a crumpled ball with the displacement of structures within the crumpled ball. So that is called as phthisis bulbi. Phthisis bulbi is very, very common after a trauma to the eyeball or following a surgery in the eyeball which has got infected, leading to this phthisis bulbi. The differential diagnosis for this phthisis bulbi is Atrophic bulbi. Atrophic bulbi is nothing but shrunken organized eyeball. I have drawn two pictures here. You can see a normal sized eyeball. I have drawn an eyeball which is small in size, which becomes very small. This is a shrunken eyeball due to atrophy. What gets atrophied? The atrophy occurs in the ciliary body. The ciliary body stops secreting aqueous humor. Slowly, the eyeball becomes smaller and smaller and smaller. This is very commonly seen in cases of glaucomas where the ciliary body gets atrophied. In cases of iridocyclitis, which is very severe, damaging the ciliary body, leading to a shrunken eyeball. Even though the eyeball is shrunken here, it is organized. If you make a cut section of it, it will appear similar to a normal eyeball with all the structures in their position. That is called as atrophic bulbi.